Welcome to Catalyzing Change Week. This year's Catalyzing Change Week is about solutions from the frontlines by social innovators.
In 2022, Catalyst 2030 concentrated its efforts on bringing proximate leaders and frontline solutions to the forefront. Collaborations led by members from the Global South produced groundbreaking reports on climate and transforming education, with an emphasis on offering local solutions. We continued our mission to create an enabling environment for social entrepreneurs to flourish by initiating a letter to donors, signed by more than 1,200 social entrepreneurs and innovators. The Catalyst 2030 awards ceremony was spectacular, and the awards themselves welcomed by the private sector, governments, bio multilaterals and donors.
Catalyst 2030 as a movement is disruptive.
One of the best things I think that's come out of Catalyst 2030 so far is incredible collaboration across the ecosystem that just didn't exist before Catalyst came into being.
The thing I love most about Catalyst is that it's an open movement for social entrepreneurs around the world.
I would encourage anyone who's looking to be more connected with their local communities around social development goals to come along to Catalyzing Change Week.
Welcome to Catalyzing Change Week.
All right, perfect. So to start off the session, I'm just going to hand it over to Olga, who is the moderator. Please take over.
Hi, good morning, good afternoon, good evening to wherever you are sitting. Namaskar, everyone. So I'm delighted to welcome you all to this panel discussion today about getting local or frontline climate change and health officials together, in the government especially, to coordinate for action. So the impact of climate change and on health and the health sector's contribution, also to the increasing global greenhouse gases or climate change itself is important. And your presence here today is very reassuring because it indicates your interest and I hope your commitment to act on it. So to understand this interrelationship between the climate change and health, the human health has been growing now for the last 2 decades. WHO estimates that between 2030, when the SDGs are supposed to be, we are supposed to be achieving our SDG goals, and 2050, 250,000 excess deaths can be attributed to climate change. So the idea is not to sort of scare and overwhelm, but for us to understand that this is a critical issue and we do need to act today, now. So we have seen, and a survey which was done by the Catalyst 2030 themselves, People's Talk, found that most people are seeing, more than 50% people are seeing the impact of climate change on health. They are already witnessing, and so are we all. So, and the what is happening is that the impacts are not only causing illnesses, but also can lead to death. And this could be in form of or because of extreme temperature conditions, increasing temperatures, so global warming, which we're talking about, heat waves, storms, floods. So that is happening. This is disrupting food systems and food security. There are increases in zoonosis and zoonotic diseases, and also the food, water, borne diseases and the vector diseases are increasing, and so are the mental health issues are increasing. We don't always pay much attention to mental health, but that is also increasing. But on one hand, climate change is impacting our health directly, but what it is also doing is undermining the social determinants, and the social determinants which are for good health, such as livelihoods, equality, access to healthcare, and social support services are also getting impacted because of climate change. So when the temperatures increase, we do get heat strokes, we get cramps, we get heat exhaustion, and also cardiovascular diseases. And the medical doctors in this know better than me, do impact and do lead to cardiovascular diseases and kidney diseases. Also, what higher temperatures are doing is, shifting the vector-borne diseases like malaria, dengue, chikungunya, which were earlier in the plains. Because of the warming and the increase in temperatures, they are moving to the hilly areas, especially in India. States like Himachal Pradesh, which were mountainous, or the Jammu and Kashmir, were not actually having malaria and dengue and chikungunya, are now witnessing and are having cases because these move faster and are getting further. Again, increasing temperatures also will increase air pollution because of the ozone. And again, air pollution, which we all know, will impact on our diseases and increase instances of respiratory illnesses like asthma, as chronic bronchitis. In addition, what is happening with the global warming and the increased temperatures is our glaciers, which in India, for example, the Himalayan glaciers, they are our major source of drinking water, because they feed into the major rivers. So when the glaciers start melting faster, they melt every year, but then if they start melting faster, we run into risks of flash floods and contamination and everything which is linked to the flooding situation. On one hand, we have the melting glaciers, but we also have rising sea levels. And rising sea levels is not only depleting or contaminating the drinking water, or the fresh water because of salination, but what is also doing is the pollutants, which from the submerged waste dumps, the nutrition losses because the agriculture or land, around it is gone. The fish catch gets impacted, and also the big part which happens is population displacement. So all this is happening because the temperatures are increasing. The list is long. I cannot go here talking about everything, but also on one hand, the temperatures are increasing, and also what we are witnessing across the globe and in India with great confidence we can talk is the rainfall is becoming very, very erratic, and the erratic rainfall and is causing a different kind of scenario. For example, in India, the Northeast, Meghalaya as a state in the Northeast was the wettest. Now it experiences dry spells, whereas a city like Mumbai is having floods, and is having rain much more than it was having. We are having these kinds of erratic rainfall causing things, and these erratic rainfalls cause displacement, cause the vector-borne, the waterborne diseases increases, but also it causes displacement of populations. So the whole social development gets impacted. And one can very safely say that most of the climate change or the impact on human development or human beings of global warming are transmitted through agriculture. In a country like India, more than 60% people, are living, and their livelihoods are centered around nature. So there are water, or there is forest or forest produce, and they get impacted with the changing patterns of the climate or erratic climate. So in three particular ways. For example, and the first way is that there is increased concentration of carbon dioxide, and carbon dioxide means more photosynthesis. Yes, it might be good for some plants, and the crop yield will increase, but it is not uniform. And I'll quote an interesting study which I read. It's one of the studies in evidence, which says that in India, for example, the high concentration of carbon dioxide could increase rice production and rice yield up to 500 kilograms per hectare. So the rice productivity will increase, but at the same time, 1% increase in temperature could damage 600 kilograms of rice per hectare. So the net gain is a loss, so there is a potential loss of what is happening. And also the increasing carbon dioxide, what it does is that many of our grains and legumes, which we consume, nutrition, they tend to reduce the zinc and the iron content. So the increased CO2 will impact, in India, more than almost 50% women have anemia. So the increase is decreased iron, even in the food which we eat, is going to only exacerbate that issue and the iron deficiency which is existing. So deforestation for agriculture, urbanization, development, mining, timber, all are also contributing in a big way to the zoonotic outbreaks that we are having. And again, the climate change and the zoonotic things. So I'm very briefly mentioned some of the impacts of climate change on health. But on the other side, healthcare without harm, which most of us know about, produces tools, gathers evidence to support the health system, contribute less to the climate change. And that estimates that from low-income countries, to high-income countries, the contribution of the health sector to the climate change, the greenhouse gases, ranges between 5 to 10%. So health sector, in a way, is the biggest guzzler of energy. Whether it is our operating theaters or the gases which are there, or the cold chain, the refrigeration of our essential medicines, vaccines, etc. They all consume energy and contribute, therefore, to the climate change or the greenhouse gases. But it doesn't mean, and it's not all gloomy, it doesn't mean that things are not happening. There are several initiatives which the health sector has taken lead on and is working on, right from solarizing the healthcare system. In Nepal, for example, they were solarizing the snake bite clinics. Snake bite clinics in remote areas are very small clinics, and the venom needs to be stored in certain temperature, and because of the electricity, erratic electricity things, it was not always there. So solarizing does help. Advocating for appropriate packaging, is something which the health sector is very aggressively, and agencies like UNDP, agencies like Healthcare Without Harm are working on and supporting governments to do that, and bringing manufacturers to do that. Also on manufacturing with low water consumption. That's another thing which is being advocated, and there is a lot of emphasis on gathering evidence for that. Alternate materials which we use in hospitals, in healthcare settings, the largest consumables are, and we have one-time use of plastics, and we have consumables. So can we find alternate materials which are used? So to work about that, preventing NCDs, non-communicable diseases, greening supply chains, managing medical waste better. Also trying to see if the procurement can be local to cut down the climate change impact. So healthcare is trying to help do its bit. But in most cases, these initiatives work in silos and are not at a scale. They are small initiatives. So they're vertical because they are silos. And what is happening is, with the understanding of climate change and health, we all see the dots. We do realize that horizontal linkages need to be made between the health sector, the biomedical interventions and the health sector, but also on the determinants and other sectors which impact so much. But it's not always easy to do. It doesn't happen automatically. It is not institutionalized, and it doesn't come organically. So what we are going to be doing today is looking at some of the examples of initiatives which have happened, and also trying to, we have a very distinguished panel here, and trying to understand from the panelists on through their experience what is happening, what can happen. So and I'm very pleased to introduce the panelists here. So our panelists here today are Ms. Supriya Sahu. She is the Secretary in Tamil Nadu, Secretary of the Government of Tamil Nadu for Environment, Forest and Climate Change. We have Dr. Kamlesh Jain, who is State Nodal Officer, Government of Chhattisgarh. We have Dr. Perez, Juan Antonio Perez, who former Undersecretary and Executive Director of the Commission on Population, Government of Philippines. We have Mr. Anand Iyer, Chief Policy Officer, Janagra, and all the others are government or former government. But I'm glad to have one voice here, Anand, who is not the government, but who works very closely with the government. And so therefore the experiences would be interesting to listen to your experiences and move forward. So is it possible for the panelists to somehow indicate? I can see two of them. I can't see, yes. So I can see two of them. I do not know whether Supriya is here already, and Dr. Jain was here. Dr. Jain, are you here?
Yeah, thank you very much.
Okay, yes, Dr. Jain is here, and I'm not very sure whether Supriya Sahu is there, but when she comes, because she has confirmed her participation. So let's begin. And from the three panelists who are already there, and when Supriya comes and joins, in your views, in your personal views, how do you describe the importance of climate change for human health in the next, say, 5 years, 10 years? So who wants to begin? Dr. Perez, you came in first, you logged in first, so maybe you can begin. Yeah.
Okay. Thank you, and good evening from the Philippines, from Manila. I'm happy to join you in this session. First of all, we have for some time in the country had what we call framework for population, health, and environment. And of course, we have always looked at the intersection of these three areas as crucial to development of the people, and particularly affecting their health, and also both population and health matters also affecting the environment. So our framework comes from that understanding, and we all know that the actions need to be local, as you were saying, Alka, and particularly as we in the Philippines. Now we are one of 12 countries with the largest, with the highest number of disasters, man-made or natural, and that also shows that not the entire country is not affected equally by these environmental or health issues, such that you have uneven development, uneven situations throughout the country. And over time, we have seen that certain areas of the country tend to be affected more by climate change, and this is actually the eastern seaboard of the country, which is facing the Pacific, where all the storms come in all the time and affect the infrastructure and the population. And this situation has led us to push for the framework of population, health, and environment to become a part of our national planning system and our population and development structure. Now, we all know that health plays an important role here. And you were mentioning, Alka, earlier that health by itself has an impact on population, development, and the environment. But for health to really have, as a sector, to really improve the situation of the people, it must rely on other sectors. Now, health does not behave in a vacuum, but there are other sectors in the population and development sector, education, for example, local governance is important. So health must accept as a sector that it needs to work as a team, as a member of a team in local development. The only role that we saw for ourselves as government was to, in a way, as this entire meeting is, to be a catalyst for this framework to be understood at the national level, to be established as policy, and later to be devolved to local units, local governments, which have different situations, and they will apply these policies as appropriate to their situation. So national government working with local sectors and all the different sectors of government can catalyze this at the national level, but it needs to be acted on locally. Thank you, Alka. That's my contribution for now.
Thank you. Thank you, Dr. Perez. Dr. Jain, would you like to go next? Sorry, Anand, it's just that I just took a call and because
no,
he came in next.
Of course, Dr. Jain, please.
Dr. Jain, would you like to go next?
Yeah, if Mr. Anand is ready to speak,
okay.
it will be
okay,
fine.
whoever.
Yeah.
For sure, I'm glad to do that. Am I audible and clear?
Yes.
Indeed. Lovely. Right. So greetings, greetings all of you, and it's a pleasure to be here. Thanks to the organizers here. A couple of prefatory notes. Janagra is an NGO, community organization, CSO working in India. We work on systems change in the urban sector. So and we work closely with the governments, as Alka had introduced. So we work closely with the governments with philanthropic and donor funding. As a systems change organization, we don't deal with the problems directly, but we believe that the systems that underpin most of these problems, if those systems can be strengthened, we can address several of those problems better. What happens is that the day-to-day maintenance and operating of our cities, the authorities tend to look at the symptoms, and one is in fact firefighting often with the capacities and resources one has to be in fact looking even at the symptoms, even if you look at waste or something like that. So what happens is systems change becomes a tougher thing to drive, but it's becoming more and more apparent, and I'll tell us why. The second note is also that climate and health are both intersectional areas in urban. So they sit very well with a systems approach, because you can never achieve climate or health by tackling one particular aspect in the urban. Let's say a mobility or a waste, it does not work singularly. The footprint will always be across, which means you need to work across a water, sanitation, mobility, energy. So, and presently we've got climate and health sitting in our policy team, which is the one that I head. And the policy team is where most of our ideas got incubated, the thought of the city systems, the research into laws and capacities and citizenship, and Dr. Perez mentioned hyperlocal action. Most of the research happens in the policy and insights team. Having given this prefatory note, I'd just like to say, for those who are not from India, a degree of context. Health, environment, and urban in India are state subjects. They're not central subjects, which means that the center can only put down guidelines and launch its own missions and schemes with the guidelines, which have to be taken up by the states. They're in fact further devolved in the 12th schedule to cities, but that action is not yet. And local capacities in the cities in all three, therefore, are quite at a premium. Urban to conduct its own actions. Several of our research has figured out that cities lack anywhere on an average, say 33% vacancies in their capacities, while their expenses on salaries themselves are so heavy. So when they are not equipped to deal with their own day-to-day functions, it becomes even more difficult to address the cross-sectional, which is health and climate. Now, seen in isolation, the environment ministry and departments would have wonderful actions. So we'll have a national action plan for climate change, state action plans for climate change. They come down to the district and stop there. Cities, several of them have voluntary city action plans, city climate action plans. The center's also got a wonderful climate smart cities assessment framework. These don't merge because the cities need to merge them into their master planning process. This is with the town planning department. So that's where there is a gap. Again, kudos in the health sector. We have great policies since, especially since 2013 and 17, we had national urban missions and policies which have laid out exactly what is to be done. Great strides in implementation. And that goes to the last mile. Therefore, the supply chains in health itself are very strong. They've been stronger in the curative space. In the preventive space, there have been great schemes with the epidemics like smallpox, now eradicated, polio, and COVID has also shown that India has been able to do a miraculous job in the backbone that supports the supply chain down to the last mile. But that does not mean you've tackled all the preventives. There's much to be done in promotives, rehabilitatives, and the social sectors. The cities are not geared and equipped. When I say cities, I mean the urban local bodies, means the authorities governing the cities are not fully empowered to decide in the areas. And this is what happens. The determinants of health and climate would be water. In health, one would call it clean water. Sanitation, health would say good sanitation. Air pollution, habitation, these are the determinants. And these are where the cities actually work on. But the climate and health imperatives on these are different, which means there is not one thing called a good road or good water supply that ticks all the boxes and is viable and can be done in time. So that integration of essential climatic and health parameters into the implementation, that point of integration seems to be missing. We've studied acts across the country, and we've studied field studies in the cities as well. The empowerment legislatively is there. The acts are clear. It is the cities at the last mile where the integration needs to happen. I'm going to sign off with just another analogy with as Alka mentioned, and we have this in the whole of the north of India, you have an air pollution problem in the months anywhere from mid-October to lasting till January. And it's very interesting because it's a health problem and COPD, etc., arising out of air pollution because the smoke is heavy, the wind is not there to carry it across. So it seems to be it's health coming into pollution. But you suddenly realize that there's a lot of stubble burning, there is a lot of dust on the roads, there is construction, and you realize that there is climate behind. For example, the window between the two seasons, which is the planting season, the harvesting season of one and the planting of the other, that window having been reduced, the farmers find it most expedient to set flame to the stubble of the harvested crops in order to be able to sow again. So in a way, it's an imperative forced on the farmer and his resources by climate, which is causing him to take an expedient action, which is having a repercussion on air pollution and health, which means the city can never tackle air pollution in its confines with its means when it is a much larger problem. So not only are your capacities constrained at your level, the problem itself is one that networks in a region. Both climate and health can be so. Cities need to think urgently simply because they are emitters, they are consumers, but they are also the most vulnerable because the densities are very high. So no matter how well you may have done in preventive, the next thing may be around the corner, which can simply have a very large effect. Yeah. Thanks. I'll stop here for now.
Yeah, thank you. Very well put. And I particularly like this example which you gave of the pollution in the northern region. and also this, in many ways, it's not just about the different actors coming together and working, but in this case, the way I understand the problem, or a bit of the problem, is how one policy has worked countering the other need, so the farmer and the cropping season and the harvesting, reducing that time, because of water, has also aggravated and learned. So sometimes the policies, well intended though, but again work in silos, and we'll talk more about them in a bit. So Dr. Jain.
Thank you very much, and very good afternoon, the organizers and Catalyst 2030 program and the eminent panelists. Before I should talk on the matter, yes, I just would like to share this. I'm in the health department and in a government of Chhattisgarh, having almost 18 years of experience in a various pathways for the disease prevention and control program. Recently, we are working for the climate change and human health impact. And if I want to go and the landscape, all the matters of this disease surveillance and disease emerging issues, or something like prevalence of the diseases and other things. So in Chhattisgarh, we were not able to talk about this climate change after before the 2020. You will not believe, nobody was talking on this matter. Although this is a worldwide, and right now everybody is talking on the climate change, but before that, really in a government sector, nobody was talking. Now it is a very good thing. Every government officials and all departments who are very much concerned on the climate change and health, human or a human health impact or other things, they are started to talking on it. So this is one of the best part actually in a government sector, I would say, because once the systematic involvement on the process will be involved, then only the things will run with sustainability. As everybody is talking on the sustainable development goal by 2030, yes, we want to sustain. We want to sustain on the policies, we want to sustain on the activities, we want to sustain on the strategies. And impact in the human part is a very high because of this climate change. No, directly or indirectly. Directly, yes, a lot of things are there. We are seeing only teeth of the iceberg. There are not lot of emerging diseases. I would like to flag only the COVID-19 pandemic. Nobody can say it is not an environmental effect, direct or indirect, but it is just because of one of the important factor is a pivotal role is the climate change. Yes, the viruses are coming, the different viruses are coming, there are a lot of mutations are happening, a lot of communicable disease, whatever you want to take, say it's like a stroke or some any other diseases or heart diseases. If you go through the fishbone analysis or something, whatever you want to do, definitely this climate change will be one of the word. Previously, people were skipping it, just they were focusing on the other issues, but now everybody is now talking on the climate change. So this is a title of the era. This is the voice. This is an emerging voice for the world, and everybody should be part of it. This is my understanding. It's not the health department, Dr. Chan as a one focal person or any other persons will not work. No, non-communicable disease, the other person who is looking after epidemics, the person who is looking after the disease surveillance, everyone should sit together and work for this climate change. And now this is a intra-departmental, but I should talk about the other departments like a panchayat, the transport department, the industry department, this private PhD, this forest, then energy, then urban, and whichever department you just would like to click it, definitely they would have some major or a minor role. I would say in a health department, what we are doing right now, I just wanted to share.
Dr. Jain, if I may interrupt you, just before you start talking about what the health department is doing, because let me put my next question, which is actually going to be, and which was about, and good, you have already started to make a reference to it. So there is an understanding, there is an acceptance and an appreciation about health and climate change. So my next question was going to be, what initiatives, has the health department or departments, because they are taken? And when we are saying taken, if we could possibly try and also give examples of special groups of people, say for the elderly, or for the pregnant women, or for urban poor, or because you come from Chhattisgarh, so in the tribal areas, So any kind of specific examples will help. And this question, of course, after you've spoken, will go to Dr. Perez and Mr. Iyer also. So, okay, Dr. Jain, over to you.
Okay, so may I continue?
Yes, continue, but then also in terms of specific initiatives for population groups, if you may want to talk about.
Okay, yeah. As I'm representing the state of Chhattisgarh, definitely would like to share the specific initiative. But as I was earlier sharing with you, systematically we need to go ahead. So yes, we have a team for the institutionalizations or for any activities. The Forest and Environment Ministry is chairing this whole committee. Then in health systems, we have another committee where we are also talking about it. The disease surveillance unit is a focal department where the climate change, human health activities are going on. But now in the state of Chhattisgarh, we wanted to talk in a 5 to 6 matter and how we initiated all these things. Like a simple, every hospital should have a green area or a garden area. If this is a voice, every hospital should work on it. This is the one thing. The solarization, it was a voice. If we want to save the energy, we want to save the electricity, we want to go for a less carbon emission, yes, we want to promote solarization. Every hospital up to sub-health center, we are promoting the solarizations. Now in a policy matter, I would like to share one thing. In a policy matter, every equipment should have a less carbon emission certified act through the industry. So this is another thing which we are going to put in our activity. You just imagine we have a 72,000 community health volunteers, which was even initiated before the National Health Mission. It's a methanogen program. Every methanogen is being trained for a climate change, and they are also participating to make a local level plan for climate change related issues. So this type of activities are going on. If we want to make a building, this should be comfortable with all activities. It's like that. So in Chhattisgarh, I would like to say the activities, the vibrations have already started, but yes, there are a lot of things to be done for a less carbon emissions, for the good energy saving activities. We prepared what is the use of solarization, how to use the solar plant in hospitals. Like a pregnant lady should not be deprived in hospitals just because of lack of electricity. You will not believe solarization improved a lot in these all aspects, and every hospital is having these things. So we focused on that part ki no one should be deprived from a light, or so no one should deprive from the hospital just because of electricity is not there. So this type of initiative we have already taken, like air studies, air pollution study. Chhattisgarh industries are there rampantly. The industries are increasing in some area like Raigad, like Korba, like Raipur, but the the pollution is day by day increasing. Now we have started to monitor it. We started to do it advocacy through the non-government organizations and through the other organizations, CHO, community-based organizations. At least you put forward the impact, you put forward the things which are not not climate friendly. At least you put forward to us, you inform to us, we will do some activities. So these type of things are going on. But in terms of policy, I'm just remembering Race to Zero 2050. This was one policy initiatives to be started or to be taken in a state of Chhattisgarh, but still there is a lot of commitment required, and that's why we could not go ahead. We could not move forward on this matter. But this is a very important activity. So these type of training capacity building programs started through the health department. We are informing to all of them. Even medical officers are getting training. We are what in terms of moving, like some area we are promoting research, some area we are moving forward with the training and capacity building program. We are involving non-government organizations to raise the voice on the climate part, because government works with some evidence-based activities, and once we will get the paper, once we will get the evidences, then only we will work hard in that way. This is a government way of working. So this type of activities are there. I don't know if I would have answered whatever you were expecting.
You have, and you have, and in your own way, you've already responded to my next question, which was going to be in terms of the gap. Evidence is extremely critical, and unless there is strong evidence, it becomes difficult for the governments to take action. So thank you, Dr. Jain.
Yeah.
Dr. Perez, would you like to share some examples about specific initiatives which the health departments have taken, and especially vis-a-vis the populations whom we consider more vulnerable, say the rural populations or the urban poor or the indigenous in the Philippines, and not the tribal, what we call them tribal here, the elderly, children. If those population groups, you have special initiatives or initiatives which are generic for everybody and not just these special groups. So if you could talk about special initiatives.
Yes, thank you, Alka. What in the Philippines, the closest, let's say, initiatives that we can talk about are what happened in the last 2 to 3 years with COVID, where we saw the impact of COVID highest among the poor. Women had higher maternal mortalities, and also infant mortality was also up. We also noted that the level of food insecurity was also elevated during that time. So it would not do just for health to make initiatives. We had to have what we usually call whole nation approach, entire nation approach to address these issues. There were some initiatives because of this situation, which was seen to be most dire in urban settings where you have high levels of congestion, poverty, where fertility is high as well. and there was an initiative for return migration. No, there was an effort to reverse the migration pattern from rural to urban, to bring the urban populations back to rural areas. Now, we realize that that really needs several levels of understanding. First, you have an acute, as a response, you have people are stranded in cities because of COVID. They could not move because of the lockdowns. So they had to be transported back to their regions. But the more important part is the acceptance of the local communities of people coming, returning to their communities. You need to generate jobs. You need to have other opportunities. You need housing, etc. for all of that. And practically in the longer term, you have to have a policy on the spatial distribution of populations. No? Now, as I said, women of reproductive age were affected also disproportionately by COVID, mainly because the health system was not able to cope with dealing both with COVID and providing the normal health care. So we had to develop two tracks of response. One a COVID track response, but also one to maintain the normative health systems. And apparently, we were unable to really make a difference when it came to maternal mortalities. We also saw a higher number of excess mortalities across the population. No, we saw higher mortalities in hypertension, in cerebrovascular diseases, diabetes. So it shows that the health system was also affected by the pressure of a disease that caused 100,000 deaths. But we also saw that the deaths from the preventable causes were even higher than COVID. We had 150,000 deaths from hypertension, cerebrovascular disease, diabetes, and maternal mortalities. So all it points is that there is a need to strengthen the health system, particularly in the areas where you have the most vulnerable populations. And this happen also to be areas where you have higher poverty, where you have higher unemployment. So the solution to health problems apparently is the health sector working with development workers in the other departments to bring down poverty that has been exacerbated by COVID, to improve food security. There has been a lot of migration because of climate change. Human mobility has increased from rural areas to urban areas. Our agriculture has declined, and that is a major problem now for the country, in that food insecurity is affecting 60% of households. So these issues are not a health sector's concern alone, but on a broader, more horizontal approach is needed. But you also need the integrating element of local governments. Now, the national government cannot have a significant impact at local community level, municipalities, or provinces where you see maybe 2-3 million population. These are managed by local governments, and their actions are crucial. And I think this is where you see a better interplay of national technical assistance to local governance efforts to improve the situations, the health, improve agriculture and others that will eventually also impact on health and on the key population. So I think we need, an identification of roles what is a national role, what is the governance role,
we'll come to that,
and how you bring together all the different sectors. Thank you very much.
Thank you so much. And something very important which you said, and we've also noticed it here, is that COVID was exceptional, of course, but it has taught us two things, and two important things which you mentioned. A was how our health systems need to be strengthened and become resilient, you know, and to be able to face emergencies like we had in at the time of COVID. And the second thing is how all attention was diverted, at least that's what happened in India, to managing COVID, and the regular preventable health conditions or, were somewhat neglected, and so the mortality which happened for preventable conditions, because the health system was not geared to or equipped enough to manage. So thank you. And of course, the point which you mentioned about the need to go local, plan together, and bring all actors together. Mr. Iyer, over to you.
Right, so I'm going to be very brief because it's better to be focused. So you asked for two examples. I'm going to give one real life and one policy example. So the real life one is something that people in India, especially in the NCR, are very familiar with. But this for the benefit for the other countries and participants here. The concept that the Delhi government started called the Mohalla Clinic is something very appropriate for your question. It had a Mohalla is essentially a neighborhood, a small community level, a neighborhood level clinic. So the urban primary health centers are there, but they are located due to other land and other land availability. They're usually clubbed with several other government facilities. They are not located exactly where the population that needs them is, the vulnerable sections. And you had always a mobile medical unit, an MMU, a van that would kind of go around offering primary health facilities. But then you have the usual problems that go with these vans, in the sense that you don't know about the route and the timing and the availabilities. And so the Delhi government came up with the Mohalla clinics, which are very small clinics exactly in the sections where the slums or the low income settlements are. And up to 100 plus medicines are actually given free. Up to 200 plus diagnostic tests are free. And all you got to do, the samples are collected right there next to your house. There will be one doctor and then one helper. And the timings are set in such a way that before you leave for work and after you come back from work. So it's 6 hours, but it is not during the key work time, because most of the people they are targeting in the vulnerable sections spend a lot of time and distance traveled, etc. for work. They can't give up a day's work unless they are really terribly ill, which means that if it is open early in the morning or late in the evening, you end up serving a lot more of the population, and you can even, there is space to think about some preventive measures. So the Mohalla clinics has been such a fantastic idea. The uptake has been there. It's now taking form in various other states, like a Namma clinic and Apado clinic, and it's getting transformed all over India. So that's a wonderful example. In policy, the 15th Finance Commission, which is the Finance Commission which devolves the grants. The cities and the states, all the taxes go to the center, bulk of them, as in not the property or the stamp duties, but the income tax and the other taxes. That fund is devolved back. And the Finance Commission advises on the devolution. After COVID, they emphasized a strong portion of grant going to the cities for health purposes. And they put a very clever mechanism in here that what is to be done for health will be guided by the health department, because they are the line ministry, they know what is to be done. But where, when, how is it to be done in the urban will be decided by the cities themselves, because then you've got the demand side, which means if I can meet a demand, you can tell me what is the medicine or the preventive or curative measure to be administered.
Okay.
I think that is a wonderful point.
Yeah, thank you so much. There has been some confusion on my end, but we're running terribly short of time. So, but the discussions have been extremely useful, very nice. And Dr. Jain mentioned COP26 when he spoke about, and he also spoke about the run. So race to zero. So what I understand from all this, and unfortunately there's no time for questions, but what we understand from all this is there is understanding, there is appreciation, there is a loud, not just felt, but articulated need for bringing the different actors together. And the time now is to act now. So 54 countries, health systems had at COP26, 62 countries had committed to make their health systems smart. We haven't spoken so much about smart health systems, but they had committed to smart health systems where hospitals will go green and will try and meet the target of race to zero by 2050, net zero emissions, or even earlier, before 2050. So I'm just borrowing from the Healthcare Without Harm's annual report title. It said, I like the title, which said that, commitment to action, but I'm just modifying it slightly. So I'm saying understanding, committing to act, and not just act, but act now. And we have examples which the three have mentioned. I know there are more. I know Philippines, for example, is doing some great work in terms of hospital waste management, like other countries. I know in India, there is a lot which has happened. I do know Chhattisgarh, which has done some brilliant work in reaching out, and Mitanin is a very strong vehicle to reach out to the tribal populations in the remote areas, for with the health services. And your solarizing is a good example, not just for the pregnant women and not just for lighting, but also for maintaining and the cold chains. Solarizing for that. And also there are countries which have started to experiment with solarizing for hospital medical waste management, so larger tertiary hospitals can definitely do that. Smaller ones will need to be more innovative on how they manage, because that is going to be contributing on one hand to the climate change, but also in terms of, if managed well, works as a preventive things. And a point which was made was evidence. We do need some strong evidence. The doctors and Dr. Jain mentioned about capacity building of the medical fraternity and the healthcare providers on understanding climate change and its impact on health. But as he himself said, there is some need for some concrete example, the effectiveness of what is being promoted. So if people talk of walking or using the stairs instead of a lift, then what is the evidence? Is it just for the individual, or is it going to be larger, contributing to the, it's going to be a drop in the whole climate change conversation. So we do need to do that. And there is so much to talk, but I'm sure there'll be other opportunities. Thank you.
Thank you.
Be here. Thank you, everyone. Thank you. Bye-bye.
Good evening.
Yeah. Bye-bye.